think we've identified that we need evidence to make any policy reforms, and our work with USAID and HFG, we're really beginning to look clearly at what we have done and the evidence for what reforms need to be made. We have a sustainability roadmap. We're looking at the capitation and its national scale up and lessons to be learned, and tidying up the whole process. We're trying to be smarter about the health purchasing, using evidence based on our current data, so that whether it's pharmaceuticals, the tariffs, we need to think smarter, think more strategically about how we purchase our health. And I think this is the focus of the work we're doing with HFG right now. We set up a committee to begin to look at how do we start the whole process of this evidence-based. And the various directorates came together with HFG, and we really began to identify key indicators that we should be monitoring. And then the idea came up of creating a dashboard, and this dashboard will give us clear pictorial evidence of what is happening in the key areas, membership claims, which are our key mandate areas, and how do we then, using the dashboard, give ourselves some early warnings, areas we need to take actions on, areas we need to alert management about any policy changes, and this is how we've started the process. The committee has worked hard to identify the data sources, how easy it is to get this data, even the quality of the data, how reliable is the data if we're going to take decisions on it. Now, what we hope is that this dashboard will be on the desktops of the key people within the organization. Right now, we are not as proactive as we could be in terms of sustainability, and this dashboard will give us the early warning signs so that we can be proactive and react to things a lot quicker than sort of a year later when we've paid the claims and there's a lot of trouble. We have been able to really set the agenda and prioritize the areas that are important to NHIA. It has been very much we driving the agenda, and that is a refreshing partnership. Once we started the project, a lot of the directorates who were not necessarily collaborating as strongly as we should have been have come together within this partnership, and we are now collaborating strongly to the betterment of the NHIA. And we've just all worked together really nicely to achieve a common goal, and I'd like to think it would continue.